It is a huge honor today to be interviewing with who I call the Rok. His first name is R-O-K, last name Stern. I'm just going to say he's from Slovenia. I've been there, but there's no way I can pronounce the city. Is that the capital you live in?
Yeah, it is, yeah.
And how do you say it?
Ljubljana.
Okay, and for our, they say if you know two languages, you're bilingual, and if you know one language, you're an American. So, So for our American friends, say it again slowly a couple times, so they might try to attempt this in their car as they're commuting to work.
Ljubljana.
And it's horrible for me to be interviewing this morning because I'm short, fat, and bald. You're rocking red headset and all that gorgeous hair. You're just I'm telling you, your dental cases. I mean, you are a rock star. Whether you call it R-O-K, your name, or R-O-C-K. I mean, really, you publish some. You've posted 1,000 times on Dental Town, and it's just an honor to be talking to you today.
Well, the honor is likewise. Thank you.
And Slovenia, I've been there with my son Greg. When I was lecturing in Venice, we drove up. We rented a car and went up. So you border Italy, where I entered from, Croatia. We went down there. Austria, Hungary. I mean that's a cool part of the world. I mean it's just gorgeous. And, where I live in Phoenix, an old historical building is about 50 years old. And how old are some of the structures in your country?
I know at least 500 years old.
Yeah, it is.
At least.
It is so gorgeous. I mean, unbelievably gorgeous. So I'd like to start out with, first of all, we have listeners from all 206 countries listen to this stuff. So for people around the world, I think a lot of people are just wondering, if you could describe, what's it like being a dentist in Slovenia? I mean, how many people are there? How many dentists are there? Do they have water fluoridation or not really? Do they drink a lot of sugar water, Coke, soft drinks? Is there a lot of decay? Talk about, to people around the world, what's it like being a dentist there?
Well, we have a population of about 2 million people. And Ljubljana, the capital, has about 400,000 to 500,000, and we have about 1,500 dentists. And I think that includes all the specialists like parodontologists, surgeons, and stuff like that. So we're pretty spread out around the country. Most dentists work in Ljubljana. If you say per person that lives in Ljubljana, there are probably the most dentists. The most saturated market, We have water fluoridation, but not as much as in the United States. The concentrations are lower, and but we don't have a lot of decay because of that, It's enough. The children usually don't drink a lot of candy or soft drinks and stuff like that, but they drink natural juices, so they have a bit of decay from that, but not as extreme as the Mountain Dew mouse that you see in the States, So I'd say the overall oral health isn't as bad as you think it would be. I'd say the worst is periodontitis. I mean, most dentists that are in the public sector, which is something like Medicaid in the States, don't really treat periodontitis. They just treat decay, and that's because they're old school. They didn't even teach the last 25 years maybe. They started teaching about periodontitis and periodontal disease here and how to treat it. But they get really low reimbursements from the insurance companies, so they don't treat it. It's like less than $2 per tooth treated. So that's why they don't do it.
So do you think they have a lot of periodontal disease because it hasn't been treated, or are there other factors that? I mean, do you think Slovenia has more periodontal disease than some other countries for some reasons?
No, I don't think that. But it's noticeable that most people have problems, I'd say. But I don't think it's. I'd say if we compare it to Sweden or the northern countries, we have more. But if we go more south, like Albania and Macedonia, then they have more than we do.
Because some things are sensitive to talk about. But I had an older periodontist tell me that he thought there were three types of teeth more associated with races that caused gum disease. He said the Chinese and the Asians had the most constricted cervical neck to where the tooth really constricts, and that precipitated more calcium and phosphorus in calculus. And then the Europeans were kind of in the middle, and the Africans had the most bulbous, and they didn't really precipitate as much calculus. And what was funny is years later, a pedodontist told me that it was harder to keep a chrome steel crown on an African child because he didn't have the undercut from the constricted cingulum. But I never see many people talking about that. But I do notice when I am in China, it seems like everybody has gum disease in China.
Yeah, I haven't been to China, so I can't tell that.
But then the other variable in China is the joking is, in America, they have a smoking section and a non-smoking. In China, it's the smoking section and the chain smoking section. So I'm sure, like most things, they're multifactorial to where it could be a constrictive cervical neck, a big increase. So gum disease. How many dental schools do you have in Slovenia? One. And how many hours does it take to drive from one end to the other of Slovenia?
Well, if you go straight across diagonally, it takes about, I'd say, a maximum of 3 hours.
Okay, so
it's pretty much highway from end to end, so you can drive fast. So
right on. So what did you want to talk about today? I mean, your cases are amazing. First of all, wouldn't you say that you're really into dentistry? What type of dentistry? Yeah. What type of dentistry gets you most excited? What is your core competencies or specialties, or what type of cases do you like to photo document and post the most on Dental Town?
Well, I do it with pretty much everything I do except surgery. I don't document surgery because it's messy and I don't have anybody to take pictures for me, because I just put another pair of gloves over my gloves to take pictures, and I could take all my pictures myself. There's a great course on Dental Town by Jason Olitsky, and I've learned a lot from that, and I don't do it between surgery because I usually have the sterile gloves on, and I don't want to put another pair of gloves over them, and so I like posterior composite and anterior composites and full mouth reconstructions. I do a lot of telescope work. You don't do that a lot in the States, but
what do you mean by telescope work? You mean a microscope?
No. Telescopic overdentures.
Oh, telescopic overdentures.
Yeah, microscope. I'm buying one till the end of this year. I had the pleasure to test the prototype of Karsten Jung's microscope for a week, and I think I'll buy one of his scopes when they officially come out at the end of this year.
Now, do you work with a dental assistant?
Yeah.
But you like to take your own photos?
Yes.
You don't like to delegate that out?
No, because we most of the dentists over here don't have the same relationship with their assistants as you do in the States, as I've seen from other people's posts on Dental Town. They can't do a lot of stuff over here, like provisionals or cleanings, or like you have those assistants who can actually make fillings. We don't have anything like that over here, so they're just chairside assisting, and it's easier for me to snap a picture than tell her what I want from the picture every single time.
Mm-hmm. Now, can they make do expanded functions, or is it a law that says no?
I think they can make nothing permanent. They could make provisionals, take pictures and stuff like that, but anything that is invasive, no. So, but most dentists over here only have one assistant.
And how many chairs?
1, 2, maybe 3.
But what would you say the average dentist has? 1 chair or 2?
1 chair, 1 assistant.
1 chair, 1 assistant. Would they have a front office person too, or just 1 dentist, 1 employee, 1 chair?
Well, over here it's like that. You have the system that is controlled by the government and a private practice that's separate, So in the public system, you are delegated by the insurance company what you have. So everybody who works in the public system, and that's probably at least a half of all the dentists, they only have 1 assistant and 1 chair and no front office, nothing. Then you have people who work for the insurance companies but out of the system. they also have one assistant, one chair, maybe two chairs if they really have enough production. And then you have private practice, and some people in private practice have 2-3 chairs and 2-3 assistants and the hygienist. Because our hygienic school for hygienists is only producing hygienists since, I think, the first graduate class was 2012 or 2013. Wow. Yeah, we didn't have any hygienists because dentists cleaned calculus. So now it's starting to develop a little bit. Our periodontics professor made the school for hygienists because he saw it in the United States, and he decided he wants to do something about that. So he started the school for dental hygienists.
That is so amazing. This is like a walk back through time for when I first went to Australia. I think it was in, I forgot what year, it was the 90s, but there were no hygiene schools, and most everybody had one chair. And now I just got back there last week, and now, now hygienists are really getting incorporated in multiple chairs. That's amazing. And what percent of the dentists live in their dental office? Where's their home and their office?
I'd say it's a really small percentage.
Really small percent?
Yeah, maybe 5%. I actually, if I think about it, I maybe know one. And they don't even live in the same house. They have a separate house for the office, and their house is really close by, like 100 meters apart. So, yeah. I love
lecturing in different countries. My goal is to lecture in every single country, and I want to podcast on every different country because so much of this is cultural. Because, like in the United States, in the West, their day off is Friday, but in the Northeast, they'll take off Wednesday. They'll do 2 days, Tuesday, then they'll take off Wednesday, then they'll go back and do Thursday, Friday, Saturday. And you only see dentists living in their house in the very Northeast, like New York, around that area, New Jersey. But many countries, they actually, the dental office is the first floor, and they live upstairs. But very, very, very interesting. So you said, let's talk first about telescopes. Talk about that, and why do you think you love them, and why do you think you don't see them used as much?
Well, they are used a lot, but not in the States. There is a lot in Germany. They do. If you go to a German forum, dental forum, there's probably, in this moment, at least 20 cases up about telescopes, how to do, what teeth to preserve and stuff like that. I just think that it's a technique that I think was developed in Germany about 30, 40 years ago. I think you had Uwe Mohr on your podcast.
Right.
He knows about that. He wants to do that more in the States, but the dentists don't know about it. So I made that post on the removable prosthodontics subforum, and I think it explains a lot. Maybe somebody will try it. The problem is
can I push that case out on social media like Facebook, Google Plus, or is that more private for Dentaltown?
No, you can if you want.
Okay, I never post a private case on Dentaltown on social media. Unless I get the doctor's permission. And I like to do it because I think a lot of people have no idea. There's 2 million dentists on earth, and it blows my mind that only 200,000 have found Dentaltown. I mean, it blows my mind. The 4 million posts on Dentaltown from guys like you are just amazing. Okay, but start from scratch. I think we're throwing around the word telescope, and you got a lot of people listening and like, okay, what does that even mean? So start from scratch and explain it. And because I know all Americans are interested in anything out of Germany, because you think of Germany, you think of Mercedes-Benz, Audi, Porsche. I mean, those guys are just – I don't think there's – I mean, when I think of making something high quality, I pretty much only think of Germany and Japan. When I think of American manufacturing, I just think of a really good marketing and advertising department. I mean, the Americans can sell snow to Eskimos. But the Germans and the Japanese, I mean, God dang, they're just the land of engineering. So why talk about the telescope and what it is, and then what would be the equivalent to it, whether the Americans doing it, and why do you think more Americans should look at this German technique?
Well, telescopes are basically a process where you conserve pretty much teeth that would be lost in most American cases. I see all these cases on Dentaltown where people just go all on 4 or all on 6, extract everything and go full implants. And maybe it's because of money over here, implants are really expensive. So telescopes are a way of using the teeth that are left, let's say 2 to 6 teeth per arch, and cover them with an overdenture. By covering them with an overdenture, you get nice aesthetics because you don't have the transition between the white and the red, the pink aesthetics. And pretty much, if any of those supporting teeth fail, you just make a simple repair to the overdenture, and the patient has their teeth in the same day or maybe the next day. So it's similar like conuses. You know, conuses.
Yes.
But the main difference is that telescopes are 0 degrees. Conuses are friction lock. They're like Synchron from Ankylos on implants. They have 4, 5, 6 degrees. I think they're just staying with 4 degrees now, and they interlock, and the connection is really rigid, and the patient usually has a hard time removing such an overdenture. With telescopes, it's 0 degrees. It's friction fit, but the path of insertion is just one. So the patient usually easily removes the overdenture, but there's no way that it will fall out unless there's maybe only one tooth remaining for the whole arch.
Okay, but if they're 0 degree and you got 2 or 3 or 4 or 5 or 6 of these things, how would you ever get them to be parallel? How would you ever get them to line up?
You need a great technician. You know, when you prep, a prep for a telescope is pretty aggressive. So you remove pretty much a lot of tooth structure, but especially on the anterior teeth, because you need room for the primary telescope and then a secondary coping and then the tooth that covers everything. So you need more room to produce aesthetics. You don't need to align the teeth 0 degrees. You just prep them roughly in the same direction, and then the technician who produces the primary copings, he then makes them parallel to each other. If he can't make them parallel, if something is wrong, I had a case where I had 6 teeth remaining, 1 molar was a bit out of line. He sent me back the cast. He said, you need to remove a little bit more from there, and then I can fix everything, you know. But I think that's why it's not really made a lot in America, because you need a great technician, and they usually cost a lot. So in America, it would probably cost the same as a 4-implant overdenture, you know.
And one of our listeners, most of my listeners are an hour commute to work. So when they get to work and they log on Dental Town, what would they type in on the search bar to find a thread? Did the title of your case have the word telescope in it? So if they did a search for telescope?
I mean, I posted a lot of cases, but they should search for the 101 telescope thread.
The what?
The 101 telescope thread.
The 101 telescope thread.
Yeah.
Awesome. And Ryan, I want to get I want to add an additional monitor so that when I'm doing these podcasts, I can actually pull that up. That would be rad. And I also want to switch from my boring black headphones, and I'm going to steal Rok's idea and get some rocking hot red ones. So the telescope. How many teeth do you like? I mean, do you like 2 on the lower, 2 on the upper? Do you prefer 4, like a table has 4 legs, so there's no rocking, or what is your ideal number of abutments?
Well, the perfect is 4.
Like a chair.
It's like the same that you want with a classic removable denture. If you got a molar or canine molar, that's the perfect you can get for removable denture, and it's the same for telescopes. But I've done cases with 1, and the maximum I did was 6 teeth. You could, in theory, do it with 16 teeth, but nobody will do it.
So these teeth don't have to have root canals.
No, it's better that they don't.
And why is it better that they don't?
The patients have a different feeling when removing and inserting on vital teeth than on non-vital teeth. So if it's on all non-vital, they tend to break them because they lose a bit of that perception.
Really?
For cracking, yeah.
I did not know that. I've always wished I had a root canal just to know what it was like and what it felt like. But that's why I think women go to women gynecologists, because back in the 50s and 60s, they got sick and tired of men telling them, it was all in their head. I'd rather, if I was a woman, I'd rather go to a woman doctor. So that's interesting. But you do say they're more expensive. Why are they more expensive? Just the lab bill's more expensive?
Yeah, and I usually use high noble percentage gold. So for the primary and secondary coping. So for each tooth, that adds a bit, let's say, $150 of gold.
And why do you feel that's worth it as opposed to using a low cost base metal?
They last longer. The friction lasts longer, and it's more precise and everything. It's and also my lab really prefers working with high noble for cases like that because it's much easier to work with a high noble alloy.
And what lab do you mostly use? The same
local.
lab? A local lab?
Local. I use a local lab for everything, but for telescopes I use one lab specifically.
Locally?
Yeah, locally.
Huh? Has that lab owner ever posted any cases on Dentaltown?
No, I don't think so.
You should tell him to do that. That'd probably be that. Some of the lab men that I know that have posted on Dentaltown say it's their entire marketing budget. It's just instead of paying money to advertise, they just pay in time and post cases on Dentaltown, and they say it's just a slot machine for business.
We don't have advertising here.
Is it illegal? Is it illegal?
For dentists, yes.
Wow, talk about that. So what does the rule say? What can you not do? Can you have a sign in front of your office?
You can have a sign that says dentist here. You can have advertisements, but they need to be educational. You know, they have to tell you why periodontal disease is bad for you and why should you get checked up by your dentist and stuff like that. So if it's too straightforward, you'll get reprimanded by the chamber. I don't think anybody has ever lost a license, but I also don't see a lot of commercials. The worst thing about that is that Croatian dentists do a lot of advertising in Slovenia, and we can't do anything about it, and we can't advertise ourselves. So people just see that all in Facebook and internet and jumbo boards and stuff like that, and we can't advertise it all. So it's a bit lopsided for us.
Yeah, and I also heard back during the war in that area, and that a lot of the nations said that if you're a war refugee, you can come here and we'll accept your license, whether you're an architect, an engineer, a dentist, whatever. And that a lot of people just got degrees on the internet and went to other countries in the region saying, I'm an architect or a dentist or an engineer, and they weren't really. Is that still an issue in 2015, or did they?
No, I never actually heard about that. So we have a lot of foreign trade dentists now, because we're in the European Union and we don't have any restrictions for moving people from other countries in the European Union. So we got a lot of dentists from Bulgaria, from Macedonia, coming over here. So
Slovenia is part of the EU. How many countries are in the EU?
I think 27, 28. So Germany, Sweden.
So you could take your license and practice in all 28 countries of the EU?
Yeah, as far as I know, yes.
Would you have to take an additional board exam or a license, or?
No, usually not.
Usually not. So then I'm curious. So why do dentists move around from one country to the other? Is it more lucrative to practice in some countries versus the others?
Money.
Money's the answer. What's the question? And so, do you stay in Slovenia because you think it's a better economic situation than if you cross the border to, say, Hungary, Italy, Croatia, or Austria?
No, I think if I'd go to Austria or Germany, I could have a salary that would be at least twice as high as I have right here now. So, but maybe I'll move. I don't know. It's hard to move when we're more tied to our roots than people in America who like to move, and then we're tied to our houses. You know, it's hard for us to sell a house and move. I think it's just psychologically over here. But my brother, for example, is just moving to Switzerland, to Zurich, and he got a job there, and so he will move. And me and my wife also think about that, but for now we're staying here with our daughter.
Yeah, well, yeah. There's nothing more home sweet home than home.
Yeah.
Yeah, that is it. But back to the telescope or
Yeah.
extracting the teeth. One red flag I've always had from dentists is, when they study the world's major religions, the only sentence or paragraph that's in common in all the major religions is only one phrase. There's no name of a person, place, thing, city, nothing, except for the one phrase, treat other people like you want to be treated. And red flags for me in dentistry are when like dentists send their own daughter to have orthodontics and bleaching, but then when it's a patient and they can't do orthodontics, they file down the teeth and do veneers. Another red flag for me on implants is when the dentist goes and gets a root canal and a retreat and all these heroic procedures to save his tooth, but then doesn't blink on pulling it on a patient and placing an implant. So I always think that's the best litmus test on every single patient. Is just like, just look at that patient and think, just what would I, even though we're have more money as dentists than most of our patients, but I still want to always think, like before you just throw that tooth away, if it was in your mouth, would you go to endodontist and have it retreated or what have you? So what other cases? What other besides what's your next topic you want to talk about? I feel like I could talk to you on any clinical subject. What else has got you excited and passionate?
Well, I think isolation, especially rubber dam isolation. I use the rubber dam for pretty much every procedure except surgery extractions. But I've used it for prosthodontics and obviously restorative. It's actually really nice when you prep a tooth for a crown the first time when you have a rubber dam on. You don't have a tongue that's in your way, a cheek that's in your way. You've got a nice field of view. It's a nice contrast, not like the mouth when you got red and black and stuff like that. You got a smooth surface behind the tooth and you can really see the depth of the preparation and everything. So the first time I prepped the tooth with the rubber dam on, it was on a patient who had half of his tongue removed because of carcinoma. And he couldn't put his tongue far back enough to seal his mouth. So every little drop that sprayed caused him a coughing fit. So I had to prep with the rubber dam on, and it was a great experience. So I've done it a lot of times since then. For restorative reasons, obviously, you don't have saliva, you don't have blood, you don't have anything, you don't have a tongue. It's really nice to work. It saves me more time than it takes me to put it on.
What percent of the dentists, of the 1,500 dentists in Slovenia, do you think put a rubber dam on a tooth before they prep it for a crown?
0.
Yeah. So since that is so rare, maybe so you just really love the isolation.
Yeah.
And I agree with you that the time to put on the rubber dam always say, for every 1 minute of time you're putting on a rubber dam, it usually saves at least 5, 6, 7, maybe 10 minutes of time. I mean, that's just the way it is. And then a lot of dentists who don't use a rubber dam, they'll numb up a patient and then they'll leave the room to go seat a crown or do a hygiene check. And all they had to do was tell their assistant to place the rubber dam because you had an assistant sitting in the room all the time. And they don't even take the energy to just turn to the assistant and say, put on a rubber dam. Have you ever tried the isolate?
No, I've seen it in action. But I didn't try it. I really don't like the high-speed suctions. I'm a bit deaf, and that sound it really makes my ears hurt, So usually when I put a rubber dam on, I take the saliva ejector out of their mouth, so it's nice and quiet.
So when you say you're a bit deaf, is that from dental high-speed sounds, or are you just teaching?
No, not from dental, not from high-speed sounds. So at least not yet. We'll see if it gets worse.
Yeah, I every once in a while, it'll pop up. Cavo has those electric hand speeds, those electric high speeds, and the massive torque. They don't go as fast, but the torque is unreal. That's another cultural thing I see when you go around the world. Like Americans always put in a air compressor and go with air-driven high speeds. And then other countries are they don't have that. They don't do that. They just go electric. Would you say of the 1,500 dentists in Slovenia, are they mostly high speed or electric?
Yeah, high speed.
And are there in the EU? Do you see any countries that are more likely to be electric handpiece versus Air
No,
turbine?
I don't think. Yeah, but most of the younger dentists stopped using the turbines. We just use the high-speed handpieces, red and blue for me. I don't
But
use the
okay,
turbine at all.
okay, I'm confused. You're saying the younger dentists do not use the air-driven turbine
No,
and use electric, or vice?
no. We all use air-driven, but we stopped using the turbine.
What does that mean? Stop using the turbine.
It's a
Is the
different handpiece.
is the turbine the electric
No,
motor?
they're all air-driven.
They're all
But
air-driven.
yeah, turbine. I don't know how you call it in the States. It's a really high-speed handpiece that has low torque, and then you have the red handpiece that's a bit slower but has higher torque, and the blue and green handpieces who are much slower. Let's say for dentin removal in caries or endopreps.
Can you do me a favor? Can you do me a huge favor? Because I don't even get that. I still don't get that. Will you start a thread on that? Because I haven't heard the blue and the red and the. I haven't
Sure.
heard that. I wish you would start a thread and explain that because one of the things that I've noticed in the I've been a dentist. You're 30. I'm 53. I've seen back in the day there were countries that were pretty much electric handpieces only. And then Americans were all air turbine. Now it's really changing. I'd really be curious to see of the 206 countries, who was all electric and went to air, who was air went to electric, or how do you feel that's progressing in the EU? Do you think there's a shift towards more electric or less electric, or do you think the air driven
No.
handpieces has dominated the market?
Yeah, they do over here. It's pretty much in every commercial we get. We don't get any electric handpieces. We just
But
get air.
are you talking about Slovenia or the whole EU?
I would say most of the. I know for sure for Germany and Austria. I don't know for France and Italy.
So Germany is going all air turbine?
Yeah, I think most of them.
Oh, that's ironic because the electric handpiece comes from Cavo and Cavo is from Germany.
Yeah, because I think pretty much every cable chair that they have over here has only air-driven pieces on it.
Well, back in the day, I did put in the electric handpieces, and I told I think it was when I'd come back from lecturing in another country, and I said, look, we were just born in air-driven, and we're going to do electric. But the three of us, the feel was so different. It wasn't that high-speed finesse with a feather. It was more of a slower. You had total torque. You could not ever stop a burr. But it's a totally different feel.
Yeah, some people on Dental Town say that they like the electric handpieces to finish the preparations. They say they're, I don't know, more precise.
I just kind of fancifully wanted the electric handpiece to win because you don't have all that plumbing infrastructure that's problematic, and it'd just be so much nicer not that just to have something that plugs into electricity instead of something that plugs into air. So what else did you want to talk about?
I know microscopes are really something that I'm into right now.
And you're still using the one that you've been demoing?
No, I don't have one now. I'm currently not really working because I'm waiting for my knee surgery. That's in three weeks. I'm going for my second ACL reconstruction.
And what did you do that made your wife hit your knee with a baseball bat?
I played volleyball.
Oh, volleyball! A volleyball injury? Were you diving for the ball?
No, I was jumping pretty high. So I teared it when I was 15 for the first time, and now I probably tore it again soon, but I lived with it, and now I really need to get it fixed. It's a really unstable knee.
Well, I'm sorry about that. That's
no big deal.
Yeah, better a knee though than a lower back or the neck or something. So tell us your thoughts on a microscope. So let me tell you the first red flag on my show. A lot of dentists said, "Man, I can see everything better, and the quality goes up so much, but man, it slows me down." They say it takes me twice as long to do it. So do you see that your quality going up and your speed going down, or do you not really?
Well, At first, probably yes, because you see so much more. But then also you diagnose much more. Because when you look at the crack at 15, 16 magnification, you really see what's in there. And you see a lot of things that you can't see with your bare eye. Okay, maybe if you're using 4.5 loops, you already see a lot. But I'm 30, and a part of the thought process on a microscope is that it's an insurance policy for me, for my neck, for my back, for my next 30, 40 years that I'll be working denture. I mean, I use loops all the time, but I still sometimes get neck pain and back pain. But with the scope, you can't flex your neck when you use the scope. You just have to look straight forward, or you don't see anything. So it is a learning curve. But when I got my first demo machine, I think I needed 1-2 patients to get used to it, and then it maybe took me 5 minutes longer than it would take me without the scope.
It's might be my only regret in dentistry. I mean, I wanted to be a dentist in the 6th grade when, how old are you in the 6th grade? 12. And now I'm 53. I mean, 41 years I wanted to be a dentist. But the only, if I had to just say, was there anything negative about it? It was trashing my neck. And it was by the time because I hung my 10-pound bowling ball head over, trying to get direct, even though I looked through a mirror. And then, and here's a big secret to save neck, not just magnification, but why do dentists always use that little 1/2 inch or 3/4 inch mirror? You can buy an 1.5 inch mirror, a 2-inch mirror. I mean, get bigger mirrors. It throws in more light. You can see the draw with the whole arch. If I walked in 10 dentist offices in Ahwatukee right now and looked on the tray set, they all have the same little size small mirror. And you walk into my op set, and I might have 3 or 4 mirrors, anywhere from 3/4 of an inch to 2.5 inch. But so I did a lot of direct vision, but my God. So finally at 50, when I was driving a car, if I just even turned my head to see if I can change lanes, there was an electric wince. And finally, a dentist friend of mine, his wife talked me into going to hot Bikram yoga. And I did it this morning. I mean, I do it at least 3 days a week. And that's just to unjack my neck. So yeah, if anything, in fact, Ryan, didn't we have an ergonomic lady coming up on one of these podcasts? Yeah, and because I really want to preach more ergonomics and more all that, because when you're 30, you think you're going to live forever, but when you're 53, you realize the price you paid by not sitting up straight. And also the chairs have changed. There's a lot of chairs that don't have the back. And you and you kneel into the chair, and there's a lot of big, exciting things going on in ergonomics. Cosmetics, anterior bonding. You post some amazing anterior work. Talk about your anterior work.
Well, I'd say I'm pretty far off in the anterior section. It's something I like to do, but there are other guys online that you just can't believe that they did it directly, Especially on Facebook, you see some cases, but then again, you have to see if that case took, 12 hours to finish.
But I'm old enough to be able to say in 1998, a lot of those legends were posting on dental school, and they'd never done any case. So just because there's some older guy that's a legend doesn't mean that you're the next guy in the batting cage. I mean, a lot of these dentists, I can remember their first questions asking, what is this? And now they're actually out there, they're legends teaching it. So, life's a journey. And if anybody was going to be a legend in any type of clinical, it would have to be you, because you got the attitude. You're really going for it. So what type of anterior work do you like? Do you like, or what would you like to master? Do you like doing direct composite veneers? Do you like prepping teeth and doing indirect veneers?
Well, everything. I think a lot of this has to do with case selection. You have to know what do you want to do in what specific case do you want to do. I mean, with a microscope, you can really finish a margin to 0.1, 0.2. So my lab works with the scope. So if I give them a tooth that is prepped to 0.1, 0.2, they can actually make a veneer that fits on that chamfer.
But let me ask you I love to I think the most informative things we can do on podcasts is not talk about anything everyone is
Yeah.
but always go after the uncomfortable question. You know what? I have heard 100 dentists in my lifetime at least say that I don't care who you are, I can spot your veneer case across the room. They're just not natural. And some of the biggest legends that do these veneer works, I just always have dentists saying, yeah, it's great, it's pretty, it's whatever, but hey, come on, we're dentists. You can still tell it's fake from across the table. And I still think the most natural work on veneers I ever see is always direct composite. And then you got to ask the dentist themselves, what do you think is better for the tooth, filing it down doing veneer or doing it direct? I think a lot of veneers are done because the dentist says, I don't want to spend all the time doing this. I'd rather have my lab man doing it. But if I was going to have veneers, I would do direct. So what are your thoughts on, what is your mind thinking about prepping off the enamel 1.5 millimeters and doing indirect veneers versus doing direct bonding?
Well, you have, as I said before, it's all about case selection. When you have a case that a patient that wants a new smile, it's always best for me to take an impression, some photos, like digital smile design, and then make a wax up and then a mock up. And when we do that flash mock up, we see if we need to remove anything or just add. So if I just need to add, maybe I can go direct composites. It's less invasive, that's for sure. But it takes a lot of time and a lot of patience, and it's really hard to pull off to have it look really, really nice. And if you go on Facebook, on Microvision group, there are guys here in Europe that do really minimal prep design, maybe even non-prep veneers. And I don't think anybody can do from direct composite like they do with feldspathic veneers. They're really thin, even no prep. So, and now we have lasers, and you can debond the porcelain practically in one piece. You don't have to worry if something goes wrong. You just pop it off, make a new one. So I think indirect, if you really want the best looking, I'd say indirect. But is it really...
And what porcelain would you like for your indirect? Feldspathic?
Yeah, or Emax. If I need to do a crown, then I usually do Emax. If I would do veneers, then it's feldspathic.
And that's kind of like asking a painter, do you like watercolors or do you like oils or do you like acrylic? So talk about, when would you like Emax, which is probably the biggest brand. I imagine that probably 4 out of 5 interior crowns or veneers are Emax versus feldspathic, which is the old schools. Talk about what you're thinking when you think about, should I do feldspathic or Emax?
Well, usually if I go full coverage, it's Emax. And for veneers, it's almost always feldspathic.
Okay, talk about that. Why? Exactly why?
I still think that feldspathic porcelain gives better aesthetics. Especially if you compare some of the cases from Europe and the United States. I talked to Glenn Van Ass in Prague this year, and all of his cases were bleach white. He said it's really easy to make a bridge in Canada when everyone wants bleach white. And over here you see a lot of really, really nice porcelain work. And it's almost all it's feldspathic. But if I go full coverage, it's Emax and sometimes even layered Emax or layered zirconia.
But again, the most fun thing about being alive half a century is I remember when I lectured in London at the Royal College of Dentists. A lot of dentists would tell me they'd say, kind of guarded, they'd say, don't you think a lot of these American cosmetic work is too white? I mean, it kind of looks goofy, and Americans, their teeth are too white, they put on too much makeup, and their boob jobs are obnoxiously too big. But now when you go to Europe, you're starting to see a lot more of this, what they used to not like 25 years ago. It's like the bleach white clown face is getting a little more popular. What do you think are major differences between Europe and North America in terms of what the average person sees as beauty or cosmetic or
Well, if we limit that to teeth, I'd say we are at least 2 shades darker than you are. So if you go bleach white, I don't think we have anything lighter than A1 here.
Agree.
Yeah.
But what besides teeth? What other things in beauty?
Yeah.
Like I noticed back in the late '80s, early '90s, shaving legs wasn't very popular.
No, that's popular.
but it's far more popular now than it was.
That's true.
2 decades ago.
Yeah, and I think in France there's still some ladies not shaving their armpits, maybe Italy, but I think that's a minority, not a majority. So,
but was that the way it was? Do you think 20 years ago, like Slovenia, 20 years ago, did your mom and grandma did they shave their legs and armpits?
I don't even know.
You never asked them that?
No.
Yeah,
I can.
I wonder if the whole world's moving towards one kind of cosmetic look.
Yeah, I think it will be because of the globalization. It's inevitable.
I think it's very cute whenever you're in Asia, around there. They the dominant fashion music culture is Korea. And if you're in China and you walk in the room, like if we all had black headsets on and you walked in with the red fancy ones, they'd say, "Oh, you're looking Korean." And so whenever you're looking fanciful, and they'd say you look Korean because they're the ones with the most pizzazz or flash music or.
And they all want white skin. When I was in Thailand, their beauty concept is white. So all the girls that are naturally dark skinned would put a lot of white makeup on, so they would look less tan. And over here, pretty much every girl wants to be more tan.
Yeah, the most tanning salons I ever saw in my life was in Poland. I mean, they call them. What do they call them? What? How do you say
Sunsnit. I don't know how they call it.
I forgot the dentists for stomatological and the sun tanning. I forgot. Was it some? I think it had, but my God, they were on every corner. Yeah, I almost thought Poland was the land of tanning beds. I never saw so many tanning beds in the world. But the most ridiculous thing is I live in the desert of Phoenix, Arizona, and there's a tanning salon on every corner, and we're only 9 miles from the sun. I mean, you could just pull up to a tanning salon, lay on the hood of your own car, and have a melanoma in an hour, and they go in and pay money and say, how? I mean, that just shows you that you can sell it. When a dentist is whining to me about how patients won't pay money for their teeth, it's like in the desert they pay money for a tanning salon. You can sell anything to any human. Humans are so funny and incredibly complex. So what else is that? So on your do you do direct composites?
Yeah, yes, I do. I do anterior and posterior. I really like posterior. I like to play with my posterior composites. It takes me a bit more time.
I want to ask you the most controversial question I can think of, and that is, so I'm going to ask you. You're a very smart guy, and I'm a big fan of your 1,000 posts. What do you think lasts longer on a first molar, an MOD 3-surface filling, an amalgam, or a direct composite?
Well, I think it depends on how it's made and who's making it. It's with composite, it's really more operator dependent. Or let's say people don't take their time that's needed for a direct composite. So with amalgam, you can get away with a lot of things. You just stuff it in there, and it will usually last as long as it's sealing properly. With composite, if you get some saliva contamination on the margin, it's going to fail catastrophically down the road. So
a direct composite is extremely technique sensitive, and if you're going fast, and you're cutting corners, amalgam would be so much better.
It's better to use amalgam.
So of the 1,500 dentists in Slovenia, for your standard, the first molar is a tooth most likely to be missing, decayed, filled, root canaled, crowned, replaced with an implant. If your average first molar in Slovenia, if 100 fillings were done, What percent would be amalgam versus composite in your country?
I'd say it's about 50-50 now.
50-50, and would that line
Yeah.
up perfectly with the public versus the private insurance system? You said half the dentists were public.
No, let's say fee for service. We only have maybe 5 to 10% of the dentists are fee for service. The rest work privately, but they have a contract with insurance company like PPO in the United States.
Okay.
Yeah, but they have a limitation of how much they can produce each year. They have a contract for, let's say, 100,000 euros per year, and that's all they can make from the insurance company. So people now pay extra, patients pay extra for posterior composites, like from premolars and back. Only from canine to canine is fully insurance paid for, and the rest is then paid extra by the patient themselves. And more patients decide to have white fillings now, especially in Ljubljana.
Okay, and the number one feedback I get from my podcast is they would say on this, like you said, you do posterior composite, so the feedback would say, well, what kind, what bonding agent? They dentists are like chefs; they want a recipe. They don't want to hear you talking about, oh yeah, I make lasagna. They're like, well, that doesn't tell me anything. What noodle did you make? Was it pork, sausage, beef? So walk me through your posterior composite use and mentioning the name brands.
Yeah, well, I use a total edge system. It's Optibond FL from Care. It's 4th generation, so primer and adhesive, and then any composite. Usually, mostly Genial from GC or Gradec from GC for composites, and Optibond FL for most all fillings, or maybe Excite. That's I think I don't know what company makes Excite, but mostly Optibond FL, and I've had great results with that, so I'm just sticking with it.
Okay, so then let me ask the most controversial question I could think on that. A lot of dentists listening to this would say, dude, I tried total etch and I had sensitivity, and I switched to a self etch, like a clear fill SE. Why do you like total etch? And why do you think you don't have problems with sensitivity, and why are you not using a self-etch? You think, again, it's just technique, isolate sensitivity?
No,
I'm sorry to be putting words in your mouth. Why do you use total etch, and why did you never go to a self-etch?
Because I never really had any problem, and it doesn't take me any more time to do it than with a self-etch, But I think if you just stick to the instructions, you won't have any problems with any bonding agent. It doesn't matter what you use, as long as you read the manual and follow the instructions. It's as simple as that. I mean, I talk I see a lot of posts on Dental Town about sensitivity issues. I mean, just follow the instructions. It's as simple as that. I mean, isolation, follow the instructions, and it's. I don't do anything special.
And why did you went with Kerr's bonding agent? How come you didn't go with Kerr's composite? Why did you switch over and use Kerr's bonding agent, but then switch over to GC to use their composite Gradia? Was it a cosmetics? Was it
no? I don't have a specific reason. I switched to Genial that's the better composite from GC for aesthetics. So that's what I use for interiors. And I'll probably even switch to GC Color. That's the top-end composite from GC over here. We don't have those the same brands as you do. We have GC, but we don't have. I see a lot of posts on Dental Town with using composites that we don't have, like from Apex Dental and stuff like that. Like Surpass.
Yeah, I still have the. I'm still shocked that we started Dental Town in '98, and now it's 2015, 17 years later, and you still have these companies that make the same product and put it in a different name in Australia than they do the United States. And I'm like, dude, the internet killed nationalism. People's identity is no longer their identity is more as I'm a dentist than I'm a dentist from Australia or New Zealand.
Yeah.
So I think the internet has killed nationalism. People's identity, like some people their identity might be their country. Some it might be their religion. A lot of dentists are identities as their profession. And with the internet and Facebook and Twitter, you can't call a product different in different countries because you're confusing the market.
Yeah.
And there's lots
It's
of
not.
books on Dental Town where they're actually trying to figure out if this product is the same as another product. And do you think, I shouldn't say this, but do you think GC is more notorious for that than other companies of calling products different in different countries?
I don't know. I really don't know.
Okay, I'm just going to leave that there. But
Yeah.
to anybody who's listening from the dental manufacturing world, when you're on the internet, I mean, it's a flat earth. I mean, we all live in one little town, and it's called Dental Town. It's called the internet. It's called your smartphone, and it's extremely confusing to the dentist when the exact same thing is called literally 15 different things in 15 different countries. Because we were classically trained. I mean, when I went to MBA school in the 90s, I mean, they said, think global, but act local. And that's what they're still playing on. But that was a pre-internet concept. After the internet, you just can't think like that. How do you what do you finish your composite with? Do you like diamonds? Do you like carbides? Do you use sandpaper disc like 3M's their disc series? What do you do for finishing up anteriors?
For anteriors, I go with soft like disc. I go with coarse and then with fine, and then I'll polish with diamond paste and that's goat skin burr. So that's my polishing process for the anteriors. For the posteriors, I just use the fine rubber soft flex disc. It's rubber, so it's not sandpapers.
Everything you just said there was pretty agreed upon, I'm sure, by the listeners, but I think the rarest thing you said is the diamond paste. I think that's a very, very rare thing used anymore. Talk about the diamond paste. What brand? Why do you use a diamond paste? I assume it's in a Profi cup?
Yeah, or you use some special polishers from, I don't know the company right now. We have a whole set from, I can't remember the name, but it comes in 3 densities, the diamond paste, and you use the special process to finish it.
But is it actually a paste, or are you talking about?
Yeah, it's a paste. It's a paste. It's in a tube, but you don't use it as much as you would use like toothpaste, just a bit, and polish it. So it gives you a nice finish.
Yeah. And how often on anterior work do you have? Is it common in your practice to have people coming back every 3 to 6 months for a cleaning if they?
In our practice, they do every 6 months, but our hygienist does that.
So you have a hygienist?
Yes, at the office that I work in, we have a hygienist, yes.
And what percent of the offices would you say have a hygienist now, since it's kind of new?
I'd say maybe 5%.
5%? And I'm not surprised that you're in the 5%. So I only got you for 3 minutes. What do you want to close on in 3 minutes?
I don't know.
How could?
Yeah, go on.
Go ahead. How could we get more? I want to do a podcast interview with a dentist from every country. I just think that would be cool. If you have any friends in Austria, Italy, Hungary, whatever, I would love to fix me up. I think that would. I think that's so interesting because I think.
I'd say you wouldn't have a problem finding someone from Italy. I think there are at least 5 or 6 guys on Dental Town from Italy, and they post some really good work. So I think from Italy won't be a problem.
I've done some podcasts with Italian doctors. Do you got any friends in Hungary and Austria?
No, not really. Maybe someone in Croatia.
Croatia?
Yeah.
I love Croatia. Croatia, the beach. The beaches in Croatia are just as gorgeous as the ones in Italy, but it's just a fraction of the price and the cost of the resort. I mean, for whatever costs $1 in Italy, what would you say it would cost on the resort on the beach in Croatia?
Well, I think it's not that much cheaper anymore.
Oh, really?
Yeah, because when you look at Croatia, they have a lot of German and Dutch patients, tourists, and that drives a bit the price up,
And you know what the most undeveloped beaches on the Mediterranean that are the most beautiful, in my opinion, is Albania.
Yeah, I'd say that too. Yeah.
I mean, you can go find beautiful beaches in Albania, and there's zero development for as far as the eye can see.
Yeah,
And
yeah,
I
yeah.
just stand there looking at this saying, wow, this could all be resorts and condos. And it's just gorgeous. Well, hey, that is our time. And I just want to say to you, seriously, I think your name is Rok, R-O-K, and you are a rock star, Dr. Rok Stern. Big fan of your
Thank you.
post. I can't think of, you only graduated in 2012.
Yeah,
And here it
I'm
is.
working for 2 years. Yeah.
And you've only worked 2 years. You've got 1,000 posts of some of the most amazing cases on dentistry. I mean, I'm trying to think of back when I was 2 years out of school. I look at where I was 2 years out of school, and I wonder if I had feet sewed to my wrist instead of hands. I can't think of one kid who's done more in the first 2 years out of school than you. So, buddy, you're a rock star.
Thank you.
It's 10 a.m. right now in Phoenix. What time is it in Slovenia?
7 p.m.
7 p.m. All right. Well, it
Yeah.
sounds like it's time for dinner. Good luck with your knee surgery, and thank you for all you've done for dentistry and for Dental Town.
Thank you, Howard. Bye.
All right. Bye-bye.